Hi, this is Zachary Ferguson. This is my presentation on inventory, lean, Six Sigma presentation for management 757, March 24th, 2024. So the steps in the DMAIC process include define, measure, analyze, improve, and control. Within these 5 phases, you must identify the problem and define the problem within your organization. You must overall improvement of the activity that is occurring in your organization. For my example, would be healthcare. You must identify opportunities for improvement. So, for example, you must identify what situation is occurring, the bottleneck within your organization. For my example, would be in the healthcare field. The bottleneck would be lack of patients going through the organization, and that causes several problems that I'll discuss later. Setting goals for the project, such as in my case would be increasing patient process throughout the organization, increasing income for the organization as well. And then finally, the last phase would be meeting goals of consumers. In my case would be patients of the organization, the clinic, their hospital, and this includes internal customers as well as external customers as well. So, for example, defining would be select the most critical and most impactful opportunities for improvement. Measure would be such as the baselines of the organization, the performance assessment, develop data, different collection methods. During analysis, examine the current data of the hospital, how many patients are going through, how many are not being seen, how's that affecting the organization's profit, what could be the profit of the organization compared to before, what could be the profit if all patients were seen on a timely manner, and then implement capability analysis for the organization as well. The next phase would be analyze. So the main goal would be to identify and test the underlying causing of the problem. This would be short staff. There's the main problem: short staff, not enough insurance carriers that are accepted that could cause patients not to be seen. So those are two main causes of the issue at my organization. And then finally complete the root cause analysis for the organization to help underline the cause and what's causing that, which would be the root. The next phase would be improvement. So start making improvements. So this will include different experiments that could be done to test out different ways to improve patient care, patient satisfaction, patient process throughout, seeing from the time they walk through the door to the time they get their diagnosis and medication if they needed it. So that could help find those and define the benefits of that, which would be increased profit for the organization, increased patient satisfaction, and then finally inform the stakeholders of the solution, so the hospital administration, the CEO, the shareholders, patients, community, to inform them as the new solution as well. And then the last phase would be control. This would be helping find and identifying new work standards for the healthcare organization and clinic, and developing quality control plan for the healthcare organization. Streamlining process improvement, and this would be the 5 S's of the lean, so that would help overall improve and streamline the process within the healthcare hospital or clinic. So here's a map of the current process at my healthcare organization. So let's start at define. So the clinical cycle time, and patient and outpatient diagnosis, patient waiting times, billing process would be measure. Then for measure, we go to analyze. This would be patient registration when they first walk in, medical costs associated with those patients and their conditions, and medical errors that could or do occur from the healthcare providers. And then we go from analyze to improve. So this would be defects such as administration errors, accounting errors, for example, pharmaceutical errors. And then subcoordinate, go to improve. This improve patient satisfaction, because if there's not patient satisfaction, then the overall healthcare clinic suffers because patients won't come back, they won't refer their friends. Then we move from patient satisfaction to control, which would be employee retention, because if you don't have employees, you can't run the business, even if since there's a lack of employees to begin with. We look at revenue cycle of the organization. Without revenue cycle, if there's low revenue, then you can't hire employees or lay people off, so that affects the organization. Then we do evaluate to control, technical requirements, computers and stuff like that. Then we go from control to divine again. And then we try to break we try to complete it. If it breaks, then we do the cycle all over again, but then we do the clinical coding, and then we go back to define again. Okay. So analysis of bottleneck for my organization would be, the bottleneck is patient flow, like I mentioned, from the time they walk into the hospital to the time they leave, or if they don't leave, but they get their medical diagnosis and treatment. So the bottleneck would be is the decreased number of patients that can be seen and processed through the clinic and hospital. That causes reduced income, as I mentioned before. Decreased patient satisfaction organization, which ultimately hurts the organization because patients don't return. As I said, loss or repeat business of those patients as well. So alternatives to address issues with evidence-based recommendations. So first, running the analysis of the bottleneck, which I just discussed, which is decreased in the number of patients that can be processed through the clinic. Next would be increasing process efficiency to make sure that patients are efficiently moved from signing in, being seen, diagnosed, exiting, getting their medication. Increasing staff, because increasing staff will allow increased patient numbers to flow through. Ensuring patients are ready to be seen, which could be done by increasing staff, such as secretaries and stuff to check patients in, insurance people, nurses, doctors, physicians, assistants, physical therapists. Considering the overbooking of appointments, if we overbook appointments, if there are not enough healthcare providers, then they can't be seen if there's not enough people to look after them. And then we can create a patient flow team of new employees or current employees, and create a new team for that, and then patient intake solutions. So benefits of this recommendation include: allows for more patients to be seen by healthcare providers, allows for greater profit of the organization, increased patient satisfaction, and repeat business of customers, patients in this case, to the organization, and then if they're satisfied, the patients telling their friends and family about the organization, therefore increasing profits of the organization. Now looking at some barriers to this plan. So referrals from satisfied patients to their families can lead to more patients being seen. However, that can lead to the organization falling back to the way it was before, where there's not enough healthcare providers, so there's more and more patients. Decreased patient satisfaction, loss in profits, and less times patients are seen by a healthcare provider. So the data chart I will use to monitor to ensure that the new initiative will continue smoothly includes a line graph This helps monitor behavior. It highlights the differences that occur, correlates with data from the past and present, and predictions of future outcomes allow the organization to see if it's working or not. You can see example of a line graph on this slide. And here are my references. Thank you.